The morning glass that changed everything. Here is something almost nobody hears at a doctor's appointment. A single glass of grapefruit juice, just 200 milliliters, roughly a cup, can permanently disable an enzyme in your intestinal wall for up to 72 hours. If you take nifedipine, felodipine, or amlodipine for blood pressure, that one glass could double the amount of medication entering your bloodstream. You did not overdose, you had breakfast, and grapefruit is only the first of 5 foods in this investigation. Each one works through a different mechanism. Some push your medication dangerously high. One makes it nearly useless. All 5 are foods your doctor probably never mentioned because, according to a 2021 CDC study, the average physician visit for a senior with multiple chronic conditions runs under 15 minutes. Food-drug interactions are almost never discussed in that window. That gap is exactly what this channel exists to fill. The drug your breakfast is fighting. Blood pressure medication is the most commonly prescribed category of drugs in the United States. According to the CDC's National Health and Nutrition Examination Survey, published in October 2024, more than 71% of American adults aged 60 and older have hypertension. That number rises to 74% among adults over 80. Most seniors in that group are on at least one of these drug classes: calcium channel blockers like nifedipine or felodipine, ACE inhibitors like lisinopril, blood thinners like warfarin or diuretics. These drugs all depend on one critical thing to do their job: precision. Too little of the drug in your system and your blood pressure stays dangerously high. Too much and it drops too far. You get dizzy, you fall, your heart takes the hit. Every one of the 5 foods in this investigation knocks that balance off, and almost none of the medication bottles in America carry a food warning on the label itself. The FDA's own guidance on this specifically notes that interaction information is typically printed in the folded inserts, not on the bottle. Most people never open them. Food 1. The breakfast saboteur, grapefruit plus calcium channel blockers. Most people who know about this interaction still don't understand how serious it is. The problem is not just that grapefruit affects your medication, it's that the effect lasts for days, and timing the juice away from your pill does nothing. Here is the mechanism. Grapefruit contains compounds called furanocoumarins. These compounds do not slow down the enzyme CYP3A4 in your intestinal wall. They permanently destroy it. Your gut cells have to grow new enzyme, and that process takes 24 to 72 hours. One glass of grapefruit juice on Monday morning means your blood pressure medication on Tuesday night is still being processed by a damaged enzyme system. In a controlled clinical study on nifedipine published in PubMed, repeated grapefruit juice consumption more than doubled the drug's area under the curve, which means roughly double the medication reached the bloodstream. For felodipine, a calcium channel blocker closely related to nifedipine, the original discovery study in 1989 found plasma levels more than 5 times higher with grapefruit than with water. David Bailey, George Dresser, and J. Malcolm Arnold published the landmark review on this in the Canadian Medical Association Journal in 2013. That research group was the original team that discovered the interaction. Their conclusion: over 85 drugs interact with grapefruit, 43 of them with potential for serious adverse effects. And older patients specifically were flagged as the most vulnerable because of age-related changes in enzyme function and the higher likelihood of taking multiple interacting medications at once. The FDA confirmed nifedipine, sold under the brand names Procardia and Adalat CC, on its consumer advisory for grapefruit interactions. Amlodipine, the most widely prescribed calcium channel blocker in America, shows a weaker but still documented interaction. The safest approach for anyone on any calcium channel blocker is to eliminate grapefruit entirely, not to time it differently. Here is the label forensics that you must be aware of. No grapefruit warning appears on the bottle label of most calcium channel blockers. It is buried in the folded insert. Most patients never see it. Ask your pharmacist directly. Food 2. The salad that confuses your blood thinner, leafy greens plus warfarin. This is the interaction that every warfarin patient has heard of, but almost nobody has heard correctly. Warfarin works by blocking the role of vitamin K in clotting. Leafy greens, spinach, kale, broccoli, Swiss chard are among the richest sources of vitamin K in any diet. When vitamin K levels rise significantly, warfarin's ability to thin the blood drops. Your INR, which is the test that measures how effectively the drug is working, can fall out of the therapeutic range. Here is what the headlines almost always leave out. The problem is not eating leafy greens. The problem is inconsistency. The 2022 Circulation Guidelines on Drug Interactions Affecting Oral Anticoagulant Therapy confirmed this directly. Sudden large increases in leafy green consumption can reduce INR to sub-therapeutic levels. A meal containing 400 grams of leafy vegetables, roughly equivalent to 2 large restaurant salads, can produce a measurable clinically relevant shift. Dr. Dima Kato, Associate Professor at the University of Southern California School of Pharmacy and Senior Fellow at USC's Schaeffer Center for Health Policy and Economics, explained this clearly. The vegetables are not the enemy. The instability is. A senior who eats consistent, moderate amounts of greens week over week can usually be dosed around that. The dangerous pattern is 1 week of no greens followed by 3 days of daily large salads, kale smoothies, and broccoli. That swings the INR. Why does this matter so much for seniors specifically? Because most seniors on warfarin are there because of atrial fibrillation. A fib affects roughly 9% of adults over 65, according to the American Heart Association. And in AFib, a clot that forms during a brief window of inadequate anticoagulation is the kind that causes strokes. The stakes are not abstract. Here is the label forensics that you must be aware of. Warfarin bottles carry a generic interaction warning, but they do not specify which vegetables or how much constitutes a problem. Your pharmacist can give you a written vitamin K consistency guide specific to your dose. Most pharmacies have one, but never hand it out unless asked. Food 3. The healthy fruit that isn't safe for everyone. This one surprises people more than any other on the list. Bananas are good for you. Avocados are good for you. Coconut water, sweet potatoes, and orange juice all carry a health halo in American culture. For someone on an ACE inhibitor, that halo deserves a second look. ACE inhibitors like lisinopril and enalapril work by suppressing the renin-angiotensin-aldosterone system. Aldosterone normally signals the kidneys to excrete potassium. Block aldosterone, and the kidneys retain more potassium than usual. That is the baseline effect of the medication. Now stack a high-potassium diet on top of it. Potassium above 5.5 millimoles per liter in the blood is called hyperkalemia. Muscle weakness and fatigue show up first. Above 6.5 millimoles per liter, the risk of dangerous cardiac arrhythmia climbs sharply. The StatPearls medical reference from NCBI, updated to cite the National Kidney Foundation 2023 data, confirms that excessive dietary potassium can contribute meaningfully to hyperkalemia in patients on ACE inhibitors or ARBs, particularly in those with any kidney function decline. Here is the senior-specific problem. Kidney filtration capacity declines with age. By 65, many adults have meaningful reductions in GFR, glomerular filtration rate, without any formal kidney disease diagnosis. That reduced filtering capacity makes it harder for the kidneys to clear excess potassium on their own. Add an ACE inhibitor that further reduces potassium excretion, and then add daily bananas, coconut water, and avocado toast. And the cumulative potassium load can move blood levels into a range that shows up as unexplained fatigue or heart irregularity before anyone connects the dots. Here is the label forensics that you must be aware of. ACE inhibitor bottle labels typically list hyperkalemia as a side effect, but never name specific foods as contributors. The insert may mention potassium-sparing diuretics as a risk, but often omits dietary potassium entirely. Food 4. The candy that competes with your diuretic. Most Americans have no idea that the majority of licorice candy sold in the United States contains no actual licorice. It is artificially flavored with anise oil, zero interaction risk. But genuine black licorice, licorice root supplements sold in pharmacies for digestive support, certain imported European candies, and some herbal teas, those do contain glycyrrhizin. And glycyrrhizin is where this gets serious. Glycyrrhizin inhibits an enzyme in the kidney called 11-beta-HSD2. Normally, that enzyme converts active cortisol to inactive cortisone. When glycyrrhizin blocks it, cortisol accumulates and starts activating the same receptors as aldosterone, causing the kidneys to retain sodium and water while flushing out potassium. That is the same direction as a diuretic. Stack them and potassium depletion can become severe. Case reports published in peer-reviewed literature have documented patients reaching potassium levels as low as 1.9 millimoles per liter, a potentially life-threatening level, from the combination of licorice intake and loop diuretics like furosemide. A 2021 review in Frontiers in Nutrition confirmed that older age is specifically associated with reduced 11-beta-HSD2 function, meaning seniors are more sensitive to glycyrrhizin at lower doses than younger adults. The Merck Manual Professional Edition specifies that doses above approximately 1 ounce per day of real licorice pose meaningful risk, especially for people with hypertension or on diuretics. Here is the label forensics that you must be aware of. Licorice root supplements look identical to any herbal capsule on a pharmacy shelf. So the ingredient names to watch for are licorice root, Glycyrrhiza glabra, and licorice extract. Deglycyrrhizinated licorice, labeled DGL, has had the problematic compound removed and is considered safe. Standard licorice root supplements have not. Food 5. The heart-healthy swap that can backfire. This fifth finding is the most counterintuitive one in this entire investigation, and I think it is the most important for seniors specifically. Salt substitutes marketed as heart-healthy alternatives to table salt. Products like no salt and new salt are primarily potassium chloride, not sodium chloride. One serving can contain 500 to 700 milligrams of potassium. For most healthy adults, that is fine. For a senior on spironolactone, triamterene, or any other potassium-sparing diuretic, or on an ACE inhibitor, it is a completely different situation. A 2024 review published in Hypertension, the American Heart Association's peer-reviewed journal, co-authored by researchers from Johns Hopkins University, stated this directly. Potassium-enriched salt substitutes should not be recommended for patients using potassium-sparing diuretics or for patients on ACE inhibitors or ARBs without direct physician clearance. Canada, as of January 2024, now requires warning labels on potassium-containing salt products. The United States currently does not. These products sit on American pharmacy shelves next to regular salt with heart imagery and the word healthy displayed prominently. No warning. A senior who decides to be proactive about their heart health cuts their sodium and switches to a potassium salt while already on spironolactone is layering potassium intake on top of a drug that reduces the kidney's ability to clear potassium. Blood potassium above 6 millimoles per liter puts the heart at direct risk. This scenario can unfold quietly without the doctor or the patient knowing a dietary switch was even made. Here is the label forensics that you must be aware of. Flip the salt substitute bottle before using it. Look for potassium chloride or KCl in the ingredient list. If you see it and you are on a diuretic or an ACE inhibitor, flag it with your pharmacist before continuing to use it. The finding that should stop you cold. Bailey, Dresser, and Arnold specifically noted in their landmark CMAJ 2013 review, the paper, written by the research group that originally discovered the grapefruit drug interaction over 30 years ago, that older patients have the greatest possibility of consuming grapefruit alongside interacting medications and are the most vulnerable to the adverse consequences. 30 years after that discovery was made, most seniors on affected medications still do not know the 72-hour window exists, still do not know that timing it away from the pill does nothing, and still receive no food warning on the bottle they pick up from the pharmacy. And beyond grapefruit, the salt substitute finding may be the most urgent, because it is the one where the marketing is actively working against patient safety. The product says heart healthy, it says low sodium, it says good for blood pressure, and for a senior on a diuretic or ACE inhibitor, it could push potassium to cardiac risk territory, with no warning label required by US law. The verdict and your one step. None of these foods need to be permanently eliminated by every senior on blood pressure medications. That is not what the evidence says. What it says is that each of these interactions is real, mechanistically documented, and clinically relevant, specifically for seniors, specifically for anyone managing multiple medications at once. For grapefruit and calcium channel blockers, separating timing is not enough. The enzyme inhibition lasts up to 72 hours. If you are on nifedipine, felodipine, or amlodipine, ask your doctor whether a medication class without this interaction is an option, or eliminate grapefruit entirely. For leafy greens and warfarin, the goal is consistency. Keep your weekly intake stable. Do not eliminate greens. That removes important nutrients. Eat roughly the same amounts week over week and document it. For potassium-rich foods and ACE inhibitors, the concern scales with kidney function. If you have any kidney involvement, ask your doctor for a serum potassium blood test. It is a standard panel and it is inexpensive. For licorice, check your supplement cabinet for the words licorice root or Glycyrrhiza glabra on any label. DGL is safe. Standard licorice root is not if you are on a diuretic. For salt substitutes, flip the bottle and read the ingredients before buying or using it. If it says potassium chloride and you are on a diuretic or ACE inhibitor, that conversation belongs with your pharmacist first. Here is the one action I want you to take today. Pull out your blood pressure medication. Go to drugs.com. It is free, no account needed, no sign-up. Use the drug interaction checker. Type in your medication name, then add the word grapefruit as a second item. If it shows a moderate or major interaction, call your pharmacist this week, not your doctor's office. Your pharmacist. They are trained specifically in drug interactions. Ask, I sometimes eat grapefruit or use a low-sodium salt substitute. Is there anything I should know given what I take? I'm Dr. Henry, wishing you a healthy and happy life.